Welcome. Thank you for joining our virtual town hall. We proudly serve the Huntington Park, Walnut Park, and City of Vernon Community Schools. My name is Yvette Fraga, and I'm your multi-tiered system of support advisor. I'll be your moderator for the evening. Before we begin with our panel, I'd like to take care of some housekeeping. Para nuestros participantes que desean traducción, me gustaría presentarles a nuestro intérprete, Kathleen Hernández. En la parte inferior de la pantalla, busque y presione el icono del mundo o globo y seleccione Español. This evening, our panelists will discuss the COVID-19 vaccine in our community and provide a summer school update. I would like to invite all participants to submit questions throughout the presentation by clicking the question icon and typing your question. Our panelists will do their best to respond. And now I'd like to introduce our Community of Schools Administrator, Gerardo Loera.
And good afternoon, and thank you so much for joining us today. We're so happy to have you. I know it's a busy time of the day. Many of you are probably getting ready for dinner, and a lot's going on in our world today. So we're going to make the most of your time today by really sharing some really important topics today regarding vaccinations, vaccination rates, as well as an opportunity for you all to come in and get a vaccine if you haven't gotten one this Saturday. But just prior to us going and sharing all that information with you, just want to share with you that here's our full Community of School team. Not everyone is on the line with us today, but we do have several of them that will be behind the scenes entertaining your questions here live. We are also live on Facebook, and on Facebook it's being done in English. If you're listening on Facebook and you want to hear in Spanish, you have to join us on our Zoom meeting. The Facebook page has the Zoom link, so you can connect to us and choose the Spanish language. So if you can take us to the next slide. So today, first of all, good afternoon once again. This week has been a historic week as we are welcoming back our middle and high school students to in-person instruction and opening up our schools as we continue on a path to recovery from the COVID-19 pandemic. Our team at Huntington Park Community of Schools has been diligently supporting the 24 schools in our community of schools for in-person instruction. Our principals and teachers and the entire schools communities are working tirelessly to ensure students return to school in the safest way possible. And so today we are delighted to have expert panelists from the medical and health fields join us in sharing information about vaccines, vaccination rates in this community, and also invite you or a loved one to receive a Pfizer or Moderna vaccine this Saturday, May 1st at Gage Middle School from 8 a.m. to 12 p.m. With us today, we have our very own LAUSD, Dr. Malhotra, who will share information about vaccine facts and provide education around that. We also have with us today Lindsay Lastra from the Department of Public Health. She will share the latest data on the vaccination rates in the Los Angeles County, and also from the community we serve right here in Huntington Park, Walnut Park, and Vernon. So like Ms. Fraga mentioned previously, we will host a question and answer session at the conclusion of this segment. If you are listening to us on Facebook, please post your questions on the Facebook comments. We will address those questions at the conclusion of this live event, but rest assured we will get to all the questions posted there as well. Lastly, after we do our Q&A, we will have Nora Gonzalez, a fellow principal supervisor and member of our HP Community of Schools, provide a brief update on where we are with summer school planning. So thank you so much for joining us this afternoon. And we look forward to providing a meaningful experience with you today. With that, I'm going to go ahead and invite our first panelist, Dr. Malhotra, who has just joined LA Unified here in January. And we're honored to have her dedicate some time to this community. And so we want to give her a nice warm welcome as she shares her information with all of us. Thank you so much for joining us.
Thank you, Mr. Loera. So my name is Dr. Smitha Malhotra. I'm the medical director for LAUSD. And I wanted to take some time with you to share some personal stories for me and also talk about the vaccine. So I want to start today by giving you a glimpse into my life last year, beginning in January of 2020. My dad had just returned from overseas, and he told me about a new virus that was emerging that had infected many on the other side of the world. And he asked me if I knew anything about it. And much like previous viruses that had emerged in the past, I researched it, but I thought that it would probably not make it to this side of the world. By February 2020, the first cases of COVID-19 began to be reported in the United States. I was leading an inpatient unit at a hospital, and we started to see a few patients come in with COVID-19. Yet, there was still an air of ease in the hospital. You know, some of us wore masks in other areas of the hospital, and some of us didn't because we didn't want to scare patients. By March 2020, our inpatient and ICU units were filled with patients affected by COVID-19. The fear amongst my hospital peers was palpable. For the rest of my life, I will always remember the feeling of walking into work while the rest of the world was on lockdown and wondering if I was going to contract a virus that had killed so many, or worse yet, bring it home to my family. I will always remember coming home and not being able to hug my kids and decontaminating myself in the garage. Never had I imagined living and working through something like this. On April 26, 2020, my mother-in-law passed away from COVID-19. She was one of the first group of people in this country to succumb to the disease. The New York Times called these deaths incalculable losses, and my mother-in-law was one of them. She died alone in her bed. We watched her funeral on Zoom. No one thinks that they would say goodbye to their loved ones in this way, but this is the reality of this disease. A disease that I thought would stay on the other side of the world came and directly affected my family. And it made me realize how interconnected we all are and how every action that we take not only affects our families, but it affects our communities and our world. And so as we listen to advice from the CDC and the Public Health Department, keep in mind that the actions we take are just not for us. They are for everyone around us. In January of this year, I became the medical director for LAUSD. I'm extremely proud of the vaccination efforts by our school district. Last week, we concluded our school sites and our drive-through site at SoFi Stadium, where we provided access to vaccines for our school staff. To date, we have given 37,000 vaccines, and we're opening 25 sites with our community partners to continue vaccinating not only our staff, but our school communities. I want to emphasize that we are not mandating vaccines. Rather, we're providing access to vaccines. Our schools are our pillars and our foundations of our communities, and it only makes sense that we take part in mitigating the public health crisis we are faced with today. Furthermore, I want to emphasize the safety and efficacy of vaccines. You know, as a pediatrician by training, I deeply understand that vaccines are one of the greatest advancements of modern medicine. After all, it was in 1920 when diphtheria claimed 10,000 lives in the United States. In the 1940s and 1950s, polio paralyzed and killed thousands of children a year. And now, thanks to vaccines, polio was officially eliminated from the United States and the rest of the Western Hemisphere in 1991. And smallpox was declared eradicated from the world in 1977. I still proudly have the scar from my smallpox vaccine, and I got my COVID vaccine right above it. The bottom line is that vaccines work. I believe in the COVID-19 vaccines. I believe in their safety and efficacy. They've all been granted emergency use authorization by the Food and Drug Administration. Now, emergency use authorization allows the FDA to make a judgment to release a vaccine in a declared emergency. And contrary to popular belief, these vaccines have been vigorously tested, and the EUA process is extremely extensive. The FDA has looked at the safety and effectiveness data for all of them before giving emergency use authorization. And vaccine development is actually an extremely rigorous process. So they go through several trials. There's a phase 1 trial where there's about 20 to 100 human volunteers. They ask questions such as, how does the dosage relate to the side effects? Is the vaccine safe and effective? And then they go to phase 2 trials where there's several hundred volunteers. And they're asking the same questions, but they're also asking what are the most common side effects? And are the volunteers making antibodies? And then they have phase 3 trials where there's several thousand volunteers. For Pfizer, there were greater than 43,000, and for Moderna, there were greater than 30,000. And now they have a large amount of data to prove efficacy of vaccines. Every company also has a data safety and monitoring board, which is an NIH-driven entity, which is an independent group of scientists that are not tied to the company or the FDA that determines that the results are unbiased. They're also monitored by the Advisory Committee on Immunization Practices from the CDC, and then the company applies for an EUA. The FDA has a completely independent board to monitor safety as well. Now, because of the pandemic, we've been forced to streamline the red tape and also be innovative in how we conduct the studies. So we're still going through all of the safety checks, just at a faster pace. And this may actually change how we do clinical trials going forward. And this might be the new normal for trials going forward. So the EUA process is actually quite extensive. A lot of people also ask how the Pfizer and Moderna vaccines work. Both the Pfizer and Moderna vaccines use a vaccine technology called messenger RNA, or mRNA, which is easy to mass produce. This technology may sound new, but it's actually been studied for more than a decade. mRNA technology was discovered 30 years ago. The coronavirus vaccine was being worked on during the 2003 SARS and 2013 MERS outbreaks. And so with the COVID-19 virus, it has a specific spike that allows it to attach to cells to infect them. And what the vaccine has done is take the blueprint for that spike, called mRNA or messenger RNA, that enters our cells and instructs them to build just the spikes of that coronavirus. So this allows our immune system to learn how to attack the virus, and it creates a memory system that goes into effect the next time you encounter the virus. The good thing about mRNA vaccine technology is that it's faster to produce because you're only producing a small portion of the virus. It also, very importantly, does not affect or interact with our DNA in any way. mRNA does not enter the nucleus of our cells where our DNA is kept. And after our cells have understood the instructions from the mRNA, they get rid of it. So the Pfizer vaccine is given as 2 doses, 21 days apart, and has been authorized for ages 16 and above. So we have been starting to vaccinate our own students with the Pfizer vaccine. The Moderna vaccine is given as 2 doses, 28 days apart, and is authorized for ages 18 and above. And both the Pfizer and Moderna vaccine have been shown to have around 95% efficacy, which means that they're 95% effective at reducing the risk of severe COVID disease after the second vaccination, which is what we want. The J&J vaccine is more of a traditional vaccine. It's what's called an adenovirus vector vaccine, which uses a cold virus to deliver the gene that carries a blueprint for the spike protein found on the surface of the coronavirus. And it is 1 dose authorized for ages 18 and above. And it is 67% effective after 2 weeks and 74% effective in the setting of variants. Now, a lot of people compare all of these vaccines, but you can't compare the efficacy of the J&J vaccine against the mRNA vaccines because they were tested with in very different places and times and with variants and a different population of people. So when we talk about vaccines, really the best vaccine is the one you can get. Also, wearing a mask, testing, and social distancing are some of the simplest things we can do to limit the spread of COVID-19. I know a lot of people talk about the dangers of wearing a mask, but anesthesiologists and many dentists, they wear a mask every day for work, every single day for their whole careers. And yet we have not seen an epidemic of pneumonias or carbon dioxide retention in these professions. And testing allows us to quickly limit the spread of COVID-19. Vaccination ultimately is a vital part of helping us to stop this pandemic. And research has shown that fully vaccinated people are less likely to be infected and potentially less likely to spread the virus that causes COVID-19 to others. So on December 21st, 2020, I got the opportunity to receive my first dose of the Pfizer COVID vaccine. I was surprised because getting that vaccine brought me to tears. I cried tears of relief, tears of joy, tears of gratitude. I got the vaccine first and foremost for my mother-in-law, who passed away 1 year ago this week from COVID-19. I got the vaccine because she did not have a chance to. I got the vaccine for all the frontline workers who put their lives on the line over this past year. And I got the vaccine because I want to play a part in getting us to the other side of this pandemic. And I understand how deeply interconnected we are to each other. This is why I got the vaccine, and I sincerely hope that you consider it too. Thank you.
Thank you so much, Dr. Malhotra. Thank you so much for your words and for sharing your story with us. Sorry for your loss. I know many of our folks that are joining us today may have experienced similar losses, so our thoughts are with them as well. I personally too have had extended family members pass in this last year due to the COVID pandemic. So I personally remember too, sitting in the line, getting ready to get the vaccine, and truly just being reflective and thankful at the opportunity to be able to receive the vaccine and not be able to, or to minimize the chances of actually coming down with that disease. So it was a reflective moment for me, thinking about all those who were not as fortunate and thinking about the thousands of others that are before us today that are considering taking it and will be making their own decisions pretty soon. So thank you so much once again. I want to invite next up on our agenda, Lindsay Lastra. She's joining us today from the Department of Public Health, and she's going to be sharing with us the latest vaccination numbers that correspond to the LA County, but also to the city that we are serving here directly in Huntington Park, as well as Walnut Park and the city of Vernon. So I want to thank her as well for joining us this afternoon and welcome her to turn on her camera and start a discussion. And one final reminder here for folks, not final, but another reminder, if you have any questions regarding our topics today, please submit them in the Q&A. We will be addressing them as we go and also have some live questions at the end. So thank you so much.
Hi, good evening, buenas noches, buenas tardes. My name is Lindsay Lastra. I am the Senior Public Health Analyst for the Department of Public Health. I'm sorry, I guess it's a little darker in here than I thought, but you're going to be looking at my slides anyways. I am from the Department of Public Health, and I'll be giving you an update on the vaccine. I too was very emotional when I got my vaccine, and so I do support all of the efforts that everyone's doing to really try to get the word out about getting the vaccine and help our families live a good rest of a life with the vaccine. Next slide, please. So I'm going to be giving you some updates, in particular around Huntington Park, Vernon, and sorry, I just blanked out on my cities, but I'll get to the 3 cities that we were talking about. So first of all, I want to give you the big picture on LA County. We are talking about that as of the 23rd of April, we've administered a little over 7 million doses. Out of those 7 million, 4.4 million, a little bit above that, have been the first doses. And about 2.5 million, 2.5 above 2.5 million doses have been the second doses. So we are definitely moving forward, trying to get our vaccines out into people's arms. Our intention is to get everyone vaccinated that wants to get vaccinated, make it be accessible to everybody, and really look into our partnerships to make that happen. We're never alone in any of these efforts. It's always about our partners, who we can connect with, how do we do this better, who are we missing, et cetera. So this is really an effort, not just from the county, from us in the county, but just the entire community in this county. Next slide, please. So I'm going to quote some data for you. This slide here shows the number of LA County residents that are 16 and over who received at least one dose of the vaccine. And you'll see it broken down by age groups. In this slide, you'll see that the group that has received the most vaccines or has received the most vaccines are the 30 to 49-year-olds. They're at about a 30.9% of our vaccinated folks. After that, we're looking at our 50 to 64-year-olds and then our 65 to 79-year-olds. So, we're really trying to get the effort out to increase these numbers, especially with our 16 to 29-year-olds. And I know the 16-year-olds, 16 to 18 just started not too long ago, but really trying to get an effort to get the vaccine out to as many different, to all the age groups as possible. Next slide, please. In this slide, we basically are trying to show ethnic breakdown of how, how many of our different ethnicities and races have received the vaccine and the relative increase. Thankfully, we have seen most of our different groups increase on how many people have gotten the vaccine. We really want to highlight in this slide that over the past 2 months, we've had many vaccination campaigns, like everyone's seeing them, not just from us, but from different entities, right? And then at an increasing rate, we are seeing our communities of color uptake the vaccine, meaning more and more individuals are getting it. In our Black African-American community, we're seeing at a 170% increase since we started the campaigns of increasing the vaccination. In our multiracial groups, we've seen 151% increase. And so these numbers aren't here. This is specifically to between March and April, but we're really kind of looking at a bigger picture and just seeing a larger increase. In our American Indian Alaska Natives, we're seeing 130% increase. And among our Latinx, Latino communities, we've seen 129% increase. And then among our Asian American Asian communities, we've seen a 91%. And around our white Caucasian communities, we've seen a 78% increase. So we're really thankful and appreciative that we're seeing increases. We definitely want to continue to see, though, more of an increase in particular to our Latinx, Latino communities, as well as our Black African-American communities, just because we are still seeing the pockets of areas where the vaccine uptake isn't there. And you'll see that in our next coming slides. Next slide, please. So first of all, I want to point out this map, you can see a better version of it on our vaccinatelacounty.com website. But we took a snapshot just to help you. I also will share that the reason you see a red border, that's actually Long Beach. In the middle of that is Signal Hill, which is part of the county. So we essentially have all of the stuff around the red and then the Signal Hill inside. But if you see the colors, the big picture here we want to show is the darker the green is the higher numbers of vaccinated or people who've gotten the vaccine. The lighter the color are the ones that have where we see less vaccine uptake. The reason you see Vernon shaded out into gray is because unfortunately, we don't have a reliable number. And so basically what that means is out of the 100 residents that we have in that city, less than 5 people have been vaccinated. So we really don't have the ability to say how many reliably what that would look like. So it's just more of a data analysis type of thing. But essentially, we really want to show here, and I'm sorry, I keep looking over to my notes, which is why I'm not looking straight in, but the reason we want to share this information is really to highlight, where when you look at our Huntington Park, really this whole middle section, right? Southgate, Linwood, you really see the lighter versions as well as, even to the left of them. to those cities where we're seeing the uptick of the vaccine, but being much lower. And so we really we're trying to do a lot of engagement in those communities, and we're looking to all of our partners to really help us get access, make it more accessible to get the vaccine into the communities. And so I will definitely invite any of you who have a potential site that you would be interested in hosting a vaccine site. If that is something of interest, or that you know of a good location, please feel free to send that to me via email through this chat here. But we're always looking to seeing other opportunities of where we can bring those vaccination sites into the communities. Next slide, please. So to highlight Huntington Park, Walnut Park, there we go, City of Vernon, or Vernon, and then we also cover West Vernon. We wanted to share here the percentage of those vaccinated in those three communities or three cities. First of all, again, Vernon shows an unreliable number, again, because of that, the number of people who've actually been vaccinated. So it's just, we're not able to really give any kind of information data on that. But when we're looking at Huntington Park, we've seen about 37, a little bit above 37% of people get vaccinated who are 16 and over. And Walnut Park, we're looking at about 42% of the population in Walnut Park that have gotten the vaccine. And then when we're looking at Los Angeles, West Vernon, which is outside of Vernon, but it kind of links in, we want to also still share that information because obviously our communities come from different areas. And so we want to kind of highlight maybe around Vernon just to share those numbers. As we see in this slide, we still have a lot of work to do, right? This is where we're really trying to focus. How do we bring in the vaccine to Huntington Park, to Walnut Park, working with Vernon, et cetera, just trying to make sure that we have better access. So if you go into the next slide, we can talk a little bit about that. This slide essentially shows that this picture shows all of the vaccination sites, either by what we call our pods, points of dispensing, also the LA City. So the ones in yellow, which are little kind of you'll see that popcorn in there. They're yellow with the black dot. Those are the ones for LA County. We have those massive kind of drive-through sites. Then you have LA City, which is like a light blue. And then we have hospital vaccination sites. We have pharmacies that we're partnering with. We're partnering with community clinics, St. John's, different entities, Kendrick Community, and I'm trying to think in Huntington Park. We're basically trying to really partner with different sites so that we increase the ability for our community residents to get their vaccine. So we don't want to limit it to just our county site, but obviously partnering with as many people as many different sites and businesses and organizations as we can to get the vaccine accessible to most. Next slide, please. So on this slide, we want to share that public health continues to work with various sectors to bring the vaccine closer. We are deploying mobile vaccination teams to people who have limited ability. Also, people who, that includes people who just can't really move easily, can't get on a car, can't get in a bus to try to go to one of those vaccine sites. We have 111 mobile sites, which are scheduled throughout the week, and we change them every week. The county is also we're working with faith-based organizations, community-based organizations, senior housing, food and agriculture sites, and other entities as to really kind of get this effort of the mobile team out so that we get to the highest risk populations. Let's see, we're also looking at, those high-risk cities or areas where there's inadequate housing, there's economic instability. So we're really trying to get to the communities that need it the most. We have at least 230 faith-based congregations across LA County partnering with us, where we're delivering the vaccine to specific zip codes who have high poverty rates. And to date, those partnerships with faith-based organizations have helped us get 30,000 total doses out. That's more than twice what this effort was projected to deliver back in March. Our faith-based initiatives are now on track to deliver more than 100,000 vaccines throughout this effort, which is very exciting for us. We're always trying to, again, look to see what kind of partnerships we need to we really help us fill the gaps of where we are with the vaccines. And like I mentioned, we are always looking for new partnerships. And so if any of you know of any sites or good partners for us, feel free to reach out to me and share that information. I think that is it. My next slide, I think, is my thank you. So if anyone has any questions, feel free to throw it up on the chat box or send them via email. Thank you.
So Ms. Lastra, we're obviously inviting questions in, but I have one question for you. As a leader here also in this particular community, I couldn't help but notice that, the lower vaccination rates in the area, like you pointed out in the slides, compared to some of the areas that are more affluent with higher incomes. Does the Department of Public Health have any insights as to why that might be the case, like as of today?
So there's a few things, and then we're still trying to research more and more, like getting more into, a deeper dive into the data. We definitely saw that many folks, although we tried to set up our large vaccination sites in lower income communities or in areas where would be an easier access to those communities, we saw people from all areas, and including those affluent areas, get in their car and make the drive out to those sites. So it always came back to their ability to use transportation more easily than our lower income communities who had a struggle with public transportation, the safety of that we're still in a pandemic. So transportation was definitely elevated and seen very much at the very beginning as a true barrier. And so, which is where we started transitioning over to these mobile sites, working with faith-based, trying to have those vaccination sites in the community, and where the community didn't have to travel to us and we came to them. But we're still seeing that we're still not meeting that gap. And so we're trying to still improve that. But definitely transportation was a barrier. And not to mention the system. I know, like everything, we were trying to set up quick. Everything was go online, get an appointment. And if you're not a computer savvy person, which I know my family, my parents aren't, many people aren't, if trying to call and be on the phone for hours was also not feasible. So there were a lot of barriers that we were trying to address, but also trying to get it set up as quickly as possible. So this has been an extremely fast-paced learning curve that we've been on. So trying to see if we're ever in the situation in the future, what are the things that we're going to have set up to resolve potentially these barriers.
Thank you so much, Ms. Lastra, for those additional insights. And thank you also for joining us today and providing this invaluable information. We're going to move on with our agenda, and we want to welcome Bernard Carrillo, and he's from one of the partners that we are working with here in the LA Unified School District. He's from the Northeast Clinics, and he's going to be sharing information with you about an opportunity that's coming up this Saturday, and I will let him elaborate on that. So I want to give Mr. Carrillo a warm welcome and to share the opportunities that are forthcoming here at Gage Middle School.
Thank you. Again, my name is Bernardo Carrillo. I'm here from Northeast Community Clinic. We are having a very a large event for the entire family this Saturday at Gage Middle School, where we'll be offering the Moderna vaccine, and we've just received also the Pfizer vaccine for our 16 and 17-year-olds. We do want to actively promote the 16 and 17-year-old students to get vaccinated. Many of them are starting school. I know there are still a lot of questions within the community, and we want to make sure that we provide a quick and adequate service for them. The registration can be simply done online. The registration is easy. It takes about maybe 4 or 5 minutes. And then when you come in, you bring in your QR code. They send you a code. We easily process you through. Wait 15 minutes after the vaccination, and you will be done for the day, and we'll schedule you for your next second dose. In addition to that, we are not asking for any insurance. We are not asking for pretty much anything else. Just come in, get your vaccination. If you don't have insurance and you need to see a provider, we can also help each of the parents and the students with those resources as well. We have several clinics throughout Southern California. So LAUSD, we've partnered with them for many years, and we are here to try to provide as many services as possible. I know the schools are also looking at testing all of the students. We're also looking to as well partner with them and the communities to be able to provide that testing so that the schools and the students can return to school as soon as possible. I'm available for any questions you may have for this Saturday. Please feel free. Thank you.
And thank you, Mr. Carrera. I have a couple of questions. I've noticed that you know, in the information that we're sharing with the community, we have said that you know, walk-ins are welcome, or they can make an appointment. And can you elaborate a little bit more on you know, folks that are with us today, or folks that that people are joining us today can share information with? You know, is an appointment needed for this Saturday?
We prefer pre-registration. You can go online to registernecc.icons.com, and it will you can choose English or Spanish, however you want to register, and register ahead of time. The reason we do this as well is because when we open a vial of either Moderna vaccine, it's a specified amount. You only have a certain amount of time to use it. So we want to calculate exactly how many doses we're going to be giving, and we can even out at the end of the day. That also goes for the Pfizer vaccine. But we also do take walk-in appointments. You just come in and you say you're here for the dose. You weren't able to register online. You can easily register at that time as well. If you need assistance with that, we will have people on standby as well to help register people who are maybe not as computer savvy or don't have the technology available that they can register online. So we can assist our patients there at that time.
Thank you. And I have another question personally as well, because you mentioned that the clinic is administering Pfizer and Moderna. And will people have a choice that they have, or is the Pfizer being limited to 16 and 17-year-olds?
We want to prioritize our 16 and 17-year-olds because the 16 and 17-year-olds cannot get the Moderna. So the Pfizer, we do want to prioritize the 16 and 17-year-olds for that Pfizer. We will have it available for parents or anybody else who would like it as well. But again, we would like to prioritize our 16 and 17-year-olds.
Thank you so much, Mr. Carrillo, for sharing that information. I've been taking a look at our Q&A. Questions, we've had a few questions submitted and answered in real time. I do want to open up the opportunity for anybody who's with us today to submit any additional questions that you might have here in the Q&A, so that we have our doctor with us who can answer very specific questions. Somebody I can see answered a very specific question regarding their child, and she answered it live. So here's an opportunity to make use of the experts. So continue to submit your questions, and we will do that. So I'll ask our panelists to sit with us for a few minutes to see if anyone else submits additional questions. Otherwise, we're going to go ahead and continue with our agenda. And I'm going to invite Director Nora Gonzalez to share the information we have about summer school coming right up.
Good afternoon, everyone. Welcome once again. For summer school, this is the information we have as of today. Summer school will be offered for students that are in TK through 8th grade, and that will be from June 22nd through July 23rd. We will have two options, in-person and virtual. The three subjects that will be offered will be math, English language arts, and integrated ELD, English language development. Right now, the time has not been decided. It is in the morning, and there will be an interest survey for those who are interested in attending. The exact times, once again, hasn't been decided. The last we've heard was 8 o'clock, starting at 8:30, and possibly ending at 11:30 or 12. But information will be forthcoming on this. And in terms of the locations, we still do not know the exact locations for summer school. Today happens to be the last, actually tomorrow is the last day for teachers to submit their interest. So first we want to see how much interest we have from teachers as well, so that we can start planning and determining how many schools will be offering summer school, how many classrooms will be in each school, and how many students. So stay tuned for further information on summer school, and we will be providing it to the schools that will be sharing it with the community.
Thank you so much, Ms. Gonzalez. I'm being told by some of our team members that there's some questions coming in on Facebook. Vanessa, if you're online with us, if you wouldn't mind just reading the question out loud.
Hi, Gerardo. This is Lillian.
Hi, Lillian. Go ahead and state the
The
question.
question is, it's from Berenice, and she asks about testing. Will the testing sites close now that schools have reopened? And also, are appointments still required? And because their location site has not been available.
Got it. So the question here has to do with COVID testing and not the vaccine, just to be specific. So the COVID testing sites are have been consolidated. So we have two general COVID testing sites in local district East. One is at Gage Middle School and the other one is up at El Sereno Middle School. So they just started this week. Those are for appointments that anybody would like to make and go to those particular sites. For all of the rest of the students and staff that are attending in-person instruction and all the staff that's actually teaching from their schools, we have the plan is to have mobile testing units actually on a schedule rotating through the various school sites on a set day and time where appointments will not be necessary. Students and staff will both be able to take their COVID test directly on the school campus. We've been focusing on the elementary schools to date, and so we're still working on finalizing the schedules for the middle and high schools. And so that is the response to that question. What other questions do we have? Ms. Fraga, are there any other questions?
Yes, hi Gerardo.
Hello.
Another question received is, if a participant or a family member received their first dose somewhere else, can they receive their second dose at Gage Middle School?
Great, and I'll defer that question to Mr. Carrillo.
Yes, they can receive the second dose at the Saturday event, but we do require them to bring proof of the first dose because there has to be a minimum of 28 days. If they receive the Moderna, it has to be a minimum of 28 days from the first dose. If they receive the Pfizer, I believe it's 21 days. So we do have to have that, that space, and that's the only way we can verify. But to answer your question, yes, they can receive the second dose there.
Thank you, Mr. Carrillo. We'll go back to the team to see if we ever have any other unanswered questions.
I have a question here. What about immigration status? Do they have to verify their citizenship in order to get the vaccine?
We do not verify any immigration status. We do not ask for any insurance. The only thing we ask is for a photo ID, and it could be whatever photo ID that you may have. Bring it in. We prefer driver's license and so forth. Just we want to make sure we spell your name correctly. We want to make sure that all the information is correct when we also give you the immunization record. When a person comes in, we input all that information. We also send it to the CalVax website, and that also registers you into CARE. With this, they keep a record that you received the vaccine. So in the future, if you ever lost a card, there is a record somewhere that you can retrieve. But we do not check any immigration status. We do not charge. We do not ask for your insurance. We do ask for, if you do have Medi-Cal, if you do have Medicare, the county does require us to ask about it, but we don't charge or collect any money or anything else or bill your insurance. if that is a concern.
And if I can add, hi, this is Lindsay Nastra again from Department of Public Health. I'll also say that we are not asking for immigration status at any of the sites. The services are free to everybody, regardless of immigration status. We do require documentation, but it doesn't have to be like a official ID or a license. It could be any kind of documentation. On our website, if anyone's going to go to any of the county sites, they can go to our website and get a list of what documentation we require. It basically just says that you're an LA County resident or you work in LA County. And I think it has like a photo with it. So, but just also to share that.
Thank you. Thank you, Ms. Lastra and Mr. Carrillo for response to that question. My understanding is that there are still plenty of spots available for folks to make an appointment for this Saturday. In fact, I'm going to ask one of our team members to please type in the link to the registration right in the chat box here, or so that all of our folks can have direct access to it if you have not yet made an appointment. It's on the flyer that we pushed out recently. And so we'll give the team a moment to do that. And I'm going to revert back to the team to see if we have any other unanswered questions as we start to wrap up our town hall this evening.
We do have one more question. It says, good evening. How will the on-site testing work if the mobile testing unit shows up weekly and to get a daily pass is required to be at school?
So the way, I'm sorry, Yvette, can you restate the question?
Sure. Let's start with just how will the on-site testing work?
So on-site testing will work as follows. So for students, we'll start there. When students get their initial baseline test, and these are for students that have returned back to in-person instruction, the parents will take the students to get their initial test, and that could be done at either Gage Middle School or El Sereno Middle School. Once they get their baseline test, the parent will be asked for a consent to be able to have the students tested on a regular basis. So once the baseline test is completed and the student is showing as negative, then the students would then be eligible to receive their daily pass. That daily pass is what students would use to actually get onto school every single day. And then at that point on, there are going to be mobile testing units that go to each of the school sites. And of course, based on parent consent, test the students there. Now, those of you who have already gotten a COVID test through LAUSD know that it's a quick process. It's painless. It doesn't hurt at all. And most of the time, it's in and out pretty quickly. As we are evolving right now with our testing pattern, we're going through some growing pains a little bit. Some of you may experience a little bit of frustration there. So we thank you for your patience as we readjust and change our strategy going forward. But our goal is to make the whole process very quick and efficient for everybody, to have it on a regular schedule to ensure that all students and staff, for that matter, that are going to in-person instruction are being tested on a regular basis.
Okay. I believe the second part of the question is, how can we get a daily pass if we're required to test weekly and the mobile team has not shown up to our school this week?
So whenever that's occurred, what we're doing is mobilizing the teams. We're in contact with the principals, and the principals are in contact with our operations people, so that we make sure that all of the mobile units are actually attending their schools. We had to make some adjustments earlier today, for example. That's part of what I mentioned earlier in terms of the growing pains as we adjust the schedule. So students ultimately will be tested, and whether it's sooner rather than later, but it will be happening in that weekly basis. And so that's where we are going, and that's what the plan is right now. And so all of this, once again, is to ensure that our students and staff are coming to school in the safest way possible. This has been a message that the superintendent has reiterated for months, and this is something that LAUSD is doing that is really aimed at maximizing the safety back on campus.
Okay, as far as I can see, we don't have any more questions in the, oh, again. So does that mean the mobile testing unit will be at schools more than once on site?
The mobile testing unit will be there on a weekly basis. That's the goal. And so yes, it will be there more than once. So that's the response to that question. On that front, we are reaching here the peak of the hour. If you're watching this session on Facebook, I want to invite you to post your questions on Facebook afterwards. We have staff monitoring the Facebook, and we will respond to your questions there. You're also welcome to see us on our Huntington Park cos.lausd.net website. We have our phone number there that you can reach us. We have Jessica Fernandez, who is there as a live person. If you want to speak to somebody in person, you're not much for the online thing, please call us. We're there to support you. You can also email us at hpcosupport@lausd.net. We are located on the Miles Elementary campus. If you just want to come by and talk to somebody in person, we are there as well, and we can be happy to see you. We're off of Saturn there on the side of Miles Elementary. On that note, I want to say a special thank you to our panelists today for making some time to speak to our community here in Huntington Park, Walnut Park, and Vernon, and also thanking the attendees that are here with us. By all means, please share the information you're hearing with your friends and your networks, so that we're trying to get the word out about this event that's taking place on Saturday at Gates Middle School, 8 a.m. to 12. Hope to see you there. Thank you all. Have a great evening.